The sensitivity of the two-tier testing in the early symptomatic stage, which is typically within the first 2 weeks, is 30%. The early symptomatic Lyme stage is basically when the infection is still treatable and it's still local. So if you give antibiotics, no problem, the Lyme will be gone. It hasn't spread to the neurological system. Sensitivity is the ability of a test to rule out disease. So having it be a true negative test. The acronym for sensitivity is SNOUT. The lower the sensitivity, the higher number of false negatives. 30% sensitivity is pretty low, so there's going to be a lot of false negatives. So these false negatives are actually really true positive. They just aren't showing up yet, which totally makes sense when we think of antibodies in the body. For the first couple weeks of the infection, maybe up to the 4-week marker, your body has not built up those antibodies yet to detect the bacteria and for your immune system to actually attack it. Those antibodies are building within the first couple weeks, and this whole two-tier testing is based on detecting these antibodies that haven't been established yet. So it makes sense that this test is not a reliable test for the first 2 to 4 weeks. This is when the disease is most treatable. So when you go in for a Lyme disease test and you just got a tick bite, the test is not going to be a reliable factor in whether you have Lyme disease or not. So you'd be better off getting an antibiotic just in case you have the disease, because if you do have the disease, the antibiotic will take care of it. If you do not take the antibiotic, then it could spread to your neurological system and become extremely hard to treat and endangering your life. It can cause heart blocks, so you're almost better off getting an antibiotic when you go in and you have a bullseye rash and some other symptoms of Lyme disease, or you know you've been bitten by a tick. This is pretty commonly known in the medical community now as of the last 10 years. If you go in with Lyme symptoms, they might not even test you. They might wait for later to test you and just give you antibiotics just in case you have Lyme to completely eliminate it while it's still local and before it has actually spread in the body.